Hello, everyone, and welcome to the Holistic Menopause Solutions Summit. I'm your host, Eliza Riley, and I'm excited to introduce you to our guest today, Dr. Brendan McLaughlin. Dr. McLaughlin is a world-renowned natural medicine physician and the founder of Aquarian Integrative Health, a pioneering clinic serving patients from around the globe. Driven by a deep commitment to integrative health, Dr. McLaughlin has dedicated his career to understanding and treating some of the most challenging health conditions through natural and integrative approaches. Aquarian Integrative Health is known for its cutting-edge treatments, blending traditional natural medicine principles with the latest advancements in energy medicine, functional neurology, biophysics, and functional psychology. Welcome, Dr. McLaughlin.
Thank you so much for having me.
It's my pleasure. So
Yeah,
let's start by talking about the challenges that women often face when trying to get a clear picture of their hormonal health.
sure.
Go ahead.
Yeah, I think when we start to open up this discussion about menopause, and first of all, I'm sure there's a lot of people listening right now and they're like, why is a man talking about menopause? Um, and I will say I sort of fell into this accidentally because what ended up happening is a lot of women would come into my office for other things, and they were being managed by a menopause doctor for what have you. And when we started to work on those other things, all of a sudden they didn't need as much hormone. They didn't need all of these other things that they had been on. And so it started getting me thinking over the years of really trying to figure this out. And so the first thing, everyone kind of does is they get blood work. And typically, for most docs, the blood work is just looking at estrogen and looking at FSH and kind of looking at that ratio. Some docs might look at progesterone and they'll say, okay, well, based on that, you're going through menopause, right? Or you're in that menopausal transition. And perhaps, but there's a lot of other things that can cause those things, including stress, including excessive dieting, including a thyroid condition. And when we're talking about blood work, I think it's important to sort of expand out what we need to look at. Unfortunately, so many people fall in the trap of just chasing one or two little numbers, and that doesn't really give us very good context about what actually is going on with the person. And we have to understand too that when we're getting blood work and we're looking at reference ranges, those references are for folks who are also having symptoms or problems, whatever. They're not necessarily the optimal age appropriate ranges for people. And so people will say, oh, I'm in range or everything's okay, or I'm out of range. But that's entirely dependent on sort of what's optimal. So oftentimes, especially with sex hormones, there's a big difference between what's optimal and what sort of the reference range is for the given lab that's doing things. Right. And so with blood work, we kind of have to expand it out just beyond estrogen and FSH and even progesterone. We have to look at the thyroid, and we really have to look at what's going on with the liver, because the liver is the thing that metabolizes all of our hormones. And so many people, so many women with hormone problems have a liver problem. And so that has to be looked at. And until that is addressed, they will precipitate, and we get all of these symptoms that we sort of come to see as menopause. But a lot of it can be down to a liver problem. And one of the biggest things I see with women that sometimes starts 10, 15, 20 years before is a history of mismanaged blood sugar. And those blood sugar fluctuations, as you know, cause a whole bunch of havoc with all the hormonal system. And unfortunately, this starts usually with women in their 20s. And it completely dysregulates their hormones. And when you're in your 20s, you're like, okay, well, my hormones are messed up. I don't feel good. I'm going to go on birth control. And then you don't change anything about the blood sugar, and you're trying to manage things with birth control. And then you flash forward 15, 20 years and you have a whole host of problems because you've never dealt with the original issue, right? And I think so many times in functional medicine, and so many times with naturopaths and different practitioners and everybody, it's easy to make things complicated because we want the newest test, we want the sexiest thing, we want all of this. And the realization, even for me, that we live in a day and age where everyone has mismanaged blood sugar, pretty much. And that's often the low-hanging fruit. So just looking at insulin, looking at A1C, looking at someone's leptin levels, and really trying to understand that and fix that with diet and all these things can be massively, massively helpful. And unfortunately, a lot of practitioners don't even touch the diet stuff. They don't even want to go there. It's just like, we're just going to give you the hormones and you'll be all fine. And sometimes that works and sometimes it doesn't. So again, we kind of have to expand our thing out. And the other thing I would say with respect to sort of lab work is one of the big things that I have found is looking at melatonin. So we're in a blood sugar crisis, but we're also the generation now that lives with less melatonin than we've ever had in our lives. And melatonin, everyone kind of thinks about it as like, oh, it's the sleep hormone. It's actually not really. It's more of the body's strongest antioxidant. And there's some derivatives of melatonin that can help us sleep, and it's involved in the sleep process, but really it's the master antioxidant. And because it works so strongly on the glands in our brain that control our sex hormones, it can be incredibly helpful at modulating our hormones. But staying up late with lights on, mismanaged circadian rhythms, living inside, doing all the things that we do, completely disrupts our melatonin, and we get into a whole bunch of trouble. And that's never sort of a conversation that's had. So you can't really measure melatonin with blood. There are some companies that do urine and saliva, and that's a little bit more advanced testing. My personal preference is urine. But I think just going on the assumption that everyone has disrupted melatonin and sort of fixing some lifestyle things and then retesting the rest of the blood work to see what happens, I think is helpful. But the one real thing that kind of gets a little bit messy is when we're looking at blood work, and this sounds like the obvious, but when we're looking at blood work, we're looking at what's in the blood, right? Now, and then we're making inferences on what's happening in the body based on what's going on in the blood. But with hormones, hormones have to act inside the cell. And so if there's a problem inside the cell or in the cell receptors, we can have great blood work, but then we still have symptoms and we still have other problems. And things like chemicals, pesticides, heavy metals, EMF, all these different things disrupt the receptors on the cell and disrupt the intracellular signaling of all these hormones. So we need a way of assessing that. And there's a whole bunch of different technologies and different things people can use. In our office, we use something called autonomic response testing to really try and see what is going on from a cell receptor standpoint and see what those interferences are in mitigating those things. Because if we just rely on blood work, one, we have to understand what the optimal ranges are. Two, we have to expand out our sort of understanding of what we're actually testing. But ideally, we also have some other form of testing that can look at the function of the cell receptors to see if the hormones are actually getting to the place that we want them to go, right?
Absolutely. So that was a lot of really good information.
Sorry, yeah. When I start, I just tend to keep going. So
Well, I had a couple of questions that came up for me. I'm hoping I was trying to
sure.
remember them all, but so earlier you were talking about testing for, well, so let me just ask the question. So often
Mhm.
when they go to their doctor and get blood tests just to determine whether or not they're perimenopausal or menopausal, and also to get some direction in how to deal with it. I'm curious how you feel like whether or not that's a problematic way to diagnose menopause.
I do think it's a problematic way, because then the reality is we're just chasing a test. And what happens is I've had countless women come into my office and come into our offices who have spent years just sort of chasing the test. And they say, well, doc, I still feel terrible. Like what's going on here? And so blood work is a necessary requirement and a piece of the puzzle. But if we don't actually sit down and have a conversation with the person in front of us and seek to understand the context of what is going on with them, then we're going to be not very successful, right? So we have to kind of expand out our testing, but above and beyond testing, we actually have to sit down and take a real health history with someone and have a real conversation with someone and say, what's going on? Rather than just, oh yeah, we'll just order the blood work and see, and then if it up. And the thing too is with blood work, when we're talking about hormones, or even with urine and saliva and those things, by nature, hormones fluctuate. And that sounds super obvious. I mean, every woman knows that. But it seems like a lot of physicians don't know that. So if we're basing decisions on just one set of labs, whether they're blood, urine, saliva, and saying, okay, we're going to do this for the next 6 months, or we're going to do this for the rest of your life based on one set of labs, that's a really big mistake. And
Yeah,
so if else, we have to continually do it, right?
yeah, absolutely. It seems short-sighted at best.
Yeah. Yeah, of course.
Yeah. The other thing that you mentioned was, um, I apologize, I'm trying to remember how you said it, but changes in how we live today compared to our
Mhm.
ancestors. So often, women get to this stage in their lives and they're like, well, my grandmother had this experience or her mom had this experience.
Mhm.
And it can be difficult for us to wrap our thoughts around the how different our lives are than it was for our grandparents and great grandparents and so on and so forth. And so I appreciate that you're pointing out that even something like melatonin is different now than it was
Mhm.
for our ancestors. And so that alone can cause a different way that our bodies are dealing with these changes.
Oh, massively. And I think that's the concerning thing for me is when we're talking about menopause, it's happening at a younger and younger age on average for people. And I think that just speaks to the fact that no matter how much science has tried, we are not separated from our environment. We're congruent with our environment. So if our environment gets more hectic, more toxic, more whatever, we are going to respond to that. And the reality is, sex hormones thrive in times where we feel safe, we feel well fed, we feel well rested. And most folks live their lives and they don't feel safe, they don't feel rested, and they don't feel fed. So, of course, we're going to have problems, unfortunately.
Absolutely. And so important for us to talk about the difference in our individual experience because of our individual situations. You know, what we're
Mhm.
like you said, like how stressed we are, the type of toxins that we're taking into our bodies. All of these things can make um, for each woman a very different experience.
Right. And I think this speaks to the biggest sort of problem in medicine, and I'm appreciative that it's changing, is for a long time, medicine has wanted to pathologize menopause, just like they pathologize pregnancy. And that's not the case because to your point, everybody's an individual, and this should be a natural, graceful process that happens. And because of everything else that's going on, they just say, okay, well, take this drug or take this or do this. And the irony is, a lot of the drugs, the side effects look like symptoms of menopause. And that's my biggest problem with this. And I have this conversation with women all the time. It's like, this is a normal process of life. This is not a medical condition. Now, there's certain things that we can do medically to make it more comfortable. There's certain things we can do to remove things that are sort of expediting the process. But this isn't a medical condition. This is sort of a normal process. And the question then becomes, how do we do this in the healthiest way possible, um, rather than sort of getting ourselves in trouble by over medicalizing the whole thing and trying to make it some disease that needs drugs.
Absolutely. And I think it's so important. One of the reasons why, the summit and doing this work is so important to me is I think that how we handle, and of course this is true in every stage of our lives, but how we handle this stage determines our longevity, determines
Right.
how well we continue to age beyond the menopause phase, which I last for the rest of our lives, but this transition.
Oh, absolutely. And I think the name of the game for me, for folks, is to live a healthy life. I don't think anyone has a desire to live till they're 100 if they're miserable for 50 years, right? So it's the quality of the years. And unfortunately, in at least across the world, but especially in America, we're losing quality of years and we're losing lifespan. Lifespan just keeps getting lower and lower and lower. And the beautiful thing is when we do natural interventions for something like menopause, so many of these supplements and herbs and other lifestyle changes and diet changes are anti-aging, are longevity promoting. And so rather than just giving drugs to solve a small problem, we can create an environment of healing where the body can actually live longer and healthier for a period of time.
Absolutely. I love that. In your work, you speak about the hierarchy of hormones. Can you walk us
Mhm.
through what that means and how it applies to menopause?
Yeah, I think one of the biggest things is sex hormones are kind of at the bottom of the totem pole as far as hormones are concerned. And the reality is, I always tell people that they're really a luxury. And our levels of our sex hormones are in large part a consequence of what's going on with the rest of our hormones. And what I always tell people is, if we don't have cortisol, so we just stop producing cortisol for whatever reason, hypothetically, we would die within days. If we didn't have any thyroid hormone, we'd die within weeks. If we lose all of our estrogen, progesterone, and testosterone, we'd be miserable, but we would survive, right? Like there's lots of different types of conditions and lots of different things where people have very, very low hormones for most of their life and they live a life, right? And so this is an important thing to consider because if our sex hormones are low, a lot of the times we have to look higher up. So, like I said, when we're talking about lab work, we have to look at what our thyroid is doing, and we have to look especially what our cortisol is doing. And everyone's kind of heard the term like cortisol steal or pregnenolone steal. And it's basically when I'm super stressed, my body wants to produce cortisol, it doesn't really want to produce progesterone and estrogen. And the problem is people think of that as like an acute situation. So they think, oh, when I'm super stressed, I just produce cortisol. That which is true, but the reality is most of us have these chronic stresses in our lives that can start from a very young age, and cause problems for our whole life. And case in point of this, there's a lot of studies on babies who are born to mothers who are undergoing severe stress, like fleeing countries, escaping wars, just terrible things no one should experience. And what that does to the child's brain, unless corrected very specifically, they will always produce more cortisol and they will never produce enough sex hormones. And that's just because our brain's saying it's not safe to do it. It's not safe to do it. And so one of the biggest things is really correcting the cortisol piece. Now, the funny thing is when we have excess cortisol for long term, we usually put on more weight, especially around our tummies. We usually have a whole bunch of other health problems. So then our solution is I'm going to work out a whole bunch. I'm going to restrict my eating. I'm going to do all of these other things that are stressful and going to long-term increase the cortisol even more, right? And so that's a huge piece for me that needs to be solved first. And yes, we can do things for the sex hormones, but if someone's in a chronic sort of fight or flight situation, it's going to be a very tumultuous thing just trying to deal with sex hormones. And the reality is too, if for those people who are treating the hormones directly, um, if you're using hormone replacement and other things, there's kind of consequences to doing that sometimes. It's not just a free-for-all easy thing to do. But when you correct that stress environment, you correct the cortisol, you correct what the thyroid's doing, the net effect of it, even if I am using HRT, I have to use way less of it because I've fixed the things that are higher up that are driving problems lower down. And I think that's just one of the things that doesn't get discussed enough. And I think on the concept of stress, everyone has this like nebulous concept of like, oh, my husband yelled at me, or oh, I'm mad at my kids, or oh, I don't like my job. And those are all true, but there's a lot of things in our environment that can be stressful. The lighting in our home, the food we eat, the water we drink, the air we breathe, all of those things. But we can also have internal stresses, right? Accumulated toxicity over our life, organ problems, all these other things. And so we're sort of stuck in the middle, sort of playing this tug of war between what's going on inside of us and what's going on outside of us. And then our body goes, wow, this is too much. I can't deal with this. And then we just ramp up cortisol. And the trick is too, what happens with a lot of women in my experience is when you're running on cortisol, it kind of feels good. So you have like, assuming you haven't completely tanked yourself, um, you have some energy. It feels good. You drink coffee, it feels better, but you're just ramping up cortisol even more. You go to exercise or spin class or whatever, you increase cortisol more, and you're sort of riding that cortisol high. And that can work because we're resilient things, but eventually it stops working. And then all of a sudden, all the other symptoms set in. And so correcting that piece of it becomes a very important thing to do.
Absolutely, that makes sense. I appreciate that you link um, toxins to as a stressor as well, because I don't think that we think about what happens in our heads as being the stressor, not what happens, on our skin and in our air, in the air that we breathe and in the food that we're eating as stressors. But it all counts, right?
Yeah, it all counts.
So, how do toxicity and chronic infections influence the menopause experience, and why is it important to address those factors in treatment?
Yeah, I think that this is an important topic for me specifically because this has been my entryway into helping women through this sort of menopausal transitions, is because a lot of people will come to me with toxicity related issues while concomitantly getting treated for menopausal issues. And when we start to correct some of the toxicities, they need less of whatever they're choosing to use for those things. And the reality is, toxins in a general sense, most of them block and corrupt the hormone receptors. So, like we are talking about kind of with the blood work and the different types of testing. And one of the most nefarious things, kind of in 2024, at least, and for the last 20 years or so, is the cell phones and Wi-Fi and all of these things that are beautiful and are allowing us to have this conversation today and allowing everyone to watch this. They aren't free in that there's always a consequence to our own biology. And specifically when it comes to hormones, this man-made EMF really disables the peptide machinery or the enzymes inside the cells that help us produce hormones. And everyone kind of knows like about endocrine disrupting chemicals like skincare products, shampoos, cleaners, all of those things. But most pesticides are also endocrine disrupting as well. And so that's where eating organic becomes very, very, very important. Um, and when we say endocrine disrupting, it's like, okay, well, what does that mean? And what that actually means is there's different molecules that look like estrogen or look like progesterone, and they will go to the cell and sit on the receptor sites. But the problem is they just stay there. They don't go anywhere. Whereas under natural fluctuations, natural hormones, they come and go based on need, based on time of day, based on time of the month, those kind of things. But when we have these there, it creates a real problem because they don't go anywhere. And then with infections, that can create a whole bunch of problems, especially challenges with the liver and with digestion. But we can also have infections directly in the uterus and the cervix and the ovaries that will cause problems as well. And one of the biggest things too is with heavy metals, things like arsenic, lead, cadmium, mercury, uh, those directly affect the ovaries in women and the kidneys. So we're having problems with cortisol. We're having problems with all of the sex hormones because of all of this accumulated toxicity. Because our body knows that all of that stuff shouldn't be there, and we're trying to get rid of it. We're trying to mount an immune response to all of these different things. And so we need elevated cortisol to kind of do that, but we're directly affecting uh, function of the hormones at a brain level with some of this toxicity, at a cellular level with some of this toxicity, and directly affecting or ovarian function as well with some of this toxicity, especially with the heavy metals. And I think one of the things that's really, mm, I don't like scaring people. I don't like fearing people. Like, that's not my thing. And I don't think that's appropriate. But the reality is, we have to be mindful of all of this stuff because, to your point earlier, um, when women come in and have a conversation with you or me or whoever, they say, oh, my grandma didn't go through this, or my great grandma didn't go through this, or even my mother didn't go through this. Well, they didn't go through it because they didn't have to deal with all of this stuff. And something as simple as EMF exposure from a cell phone, Wi-Fi, smart TV, whatever, has been shown for years to accelerate ovarian aging. And so we're getting this onset of menopause earlier and earlier and earlier because we keep having all of this technology and all of these other things. And like I said, especially on the technology part, we kind of need it and we use it and it's a part of our lives. But there are ways to mitigate this stuff. There are ways to make this sort of more acceptable for our biology. And when it comes to heavy metals and pesticides and all these other things, there's ways to remediate that stuff. We just have to know where to look and how to deal with that kind of stuff so that our body can feel safe enough to produce hormones for an age appropriate level. And then if we need to do any kind of supplementation on top of that, uh, we don't have to use as high amounts or we don't have to have sort of this constant struggle between all these things.
I so agree with you. And um, I, I'm loving everything that you're sharing with us, but we are about out of time. So
Okay.
just I feel like you've already answered this, at least in part, but just to be very clear, how does Aquarian Integrative Health approach the treatment of menopause differently from more conventional medicines? And just as a follow-up, can you share some examples of some of the advanced or integrated techniques that you use to address complex cases?
Sure. Yeah. I think first and foremost is just a framework of for us, like what we actually do. And that's really seeking to understand the full context of a patient. And so we have a rigorous diagnostic process to really cover a lot of different things, not only on a physical level, but a mental, emotional level, and multiple different levels of our existence to really see what is going on with someone's life, right? Because it's not just a magic pill, it's not just a magic supplement, it's not all of that. There's sort of so much more to it. And we also have to strongly consider, like I've talked about, our environment's changed.
Mhm.
And we need to do things to make our environment more conducive to human biology. Because the best supplement protocol in the world or best medication in the world isn't going to be as effective anymore because we've changed our environment so much. So for us, we utilize a lot of technologies essentially to get people back to nature, whether it's different light therapies, different sound therapies, different frequency devices, to really bring these things back into people's lives properly. And I think when we're talking about dealing with hormones directly, we use a lot of herbal therapies because to me, herbal therapies are really helpful at regulating rather than with hormone substitution, you're trying to sort of force something to happen. Whereas when you use herbal therapies, whether it's for the adrenals or the thyroid or progesterone or estrogen, it allows for better regulation. And the reality is, especially when it comes to estrogen, if we're doing estrogen type therapies, um, there's a consequence to doing that and can often lead to undesirable effects if we're not careful. And so we really have to understand that. So first and foremost, it's understanding the context of someone, getting them into a healing environment, and then applying the right supplements or medications or other interventions to help people. And I think as far as interesting techniques, one of the things that I think is so important is somebody's mindset. And for me, I've spent a lot of time studying, understanding, and helping people on the level of mindset, on the level of limiting beliefs, on the level of all these things. And with respect to hormones, I think one of the important things is we can actually develop an allergy to our hormones. And I've seen many women who've started progesterone therapy with another practitioner and had terrible reactions to it. And this goes back to sort of different kinds of psychological work, um, where if women have a problem with progesterone, often they have a problem with themselves, limiting belief about sort of their own femininity, or they have a problem with their mother. And this seems sort of esoteric and tangential, perhaps, but again, taking into context sort of everything, the sort of woman who comes into my office might have problems with her mother. She's been sort of in charge of her household because husband's busy at work and the kids are crazy, and she's had to manage that whole situation for 20, 30, 40 years. And women like that tend to have really high testosterone. So they have a problem with progesterone and estrogen. They have high testosterone because they've literally had to become the man of the house, if you will. And then they have heavy metal toxicities, maybe some infections, maybe some other types of toxicities. These are a problem. Digestion's no good. And so rather than just slapping on some progesterone or slapping on some estrogen or DHEA and kind of hoping for the best, we really have to sit down and say, hey, these are all the things that's going on. And this is how we're going to attend to it. And unless someone, unless a woman is sort of ready for that transition, it becomes hard, right? Becomes and it is nobody wants to get old. None of us do. Um, and so it's coming to this sort of point of divine acceptance once we've removed the things that are accelerating the situation in the first place. I think so many people get stuck because one, nobody wants to get older. but nobody's told them that there's all these other things that are accelerating the thing that's happening naturally. And I think once we can identify those things for people and help them remove them, then you get to age gracefully and beautifully. It's a wonderful thing.
Absolutely. I think that it's so important, like you said, what you said about mindset. Um, the saying, that our thoughts at least influence, but often create our reality. It is absolutely true. And I think that as a society, we have made aging such a negative, especially for women. And so when
Correct. I mean, it's so unfortunate. And it's really a sad thing. And what I always tell people is the rate at which we age is entirely dependent on our health and our environment. And that includes the health of our thoughts too. And that's why you see people who age gracefully and beautifully, and some people, men and women, by the time they're 45, they look like they're 70. And so, yes, with respect to menopause, it's important to figure out the root causes. It's important to correct any hormone issues. But bigger picture, this is really about aging gracefully and beautifully and in a very healthy way so that you can live as long as you like.
Absolutely, I love that. Thank you so much, Dr. Brendan, for sharing your insights and your expertise. For those in the audience who want to learn more about your work or explore the resources available at Aquarian Integrative Health, where can they find more information?
Yeah, so our website is aquarianhealthsolutions.com. We've got a ton of information on there, and our sort of all of our written work and our podcast is over on Substack, so aquariansolution.substack.com.
Very good. And do you have a resource for the community?
Yeah, so we have a little short course called the Realign Regimen, and it's really teaching people the things that we need to fix sort of in our home with our air, our water, our cleaning supplies, our EMF environment, and really allowing people to have a safe, healthy environment so that whatever other treatments they do can be helpful and to the maximum benefit for everybody. And for everyone on the summit, that resource is going to be free, and Eliza is going to have a lovely code for everybody.
Absolutely, I will. Thank you again, Dr. McLaughlin, for being here with us today. You provided incredible insights into the complexities of menopause and the unique integrative approaches that can make a difference. We've covered everything from the limitations of standard testing to the impact of toxicity and chronic infections, as well as the importance of treating each patient with the full context of their life and health. For everyone tuning in, please be sure to visit Dr. McLaughlin's clinic, Aquarian Integrative Health, for more information on these advanced approaches to wellness and integrative care. And be sure to pick up that free resource so you can go deeper into the things that we've talked about today. Thank you,
Absolutely.
everyone.
Thanks.
Thank you, everyone, for joining us. We hope you found this conversation both informative and empowering. Until next time, take care and be well.
Thank you.